everybody. I'm Dr. Monica from Hometown Integrated Medicine here in Lancaster, Ohio. I'm here today with my patient and cousin, Jantzen. Jantzen, we work a lot on issues that he has with his scoliosis. Scoliosis is the abnormal lateral curvature of the spine. From this full front view, your spine should be nice and straight, but when we look at the body from a side view, you should have these natural curvatures in the spine. When we're talking about the abnormal lateral ones, they're going left and right of center. So Jantzen, what is bothering you today?
Today's not bad.
Good. So what are some of the things that have improved since last time?
So we did like soft tissue down low to offset up top in the shoulder blade. That kind of had soreness, tenderness for half the week. And then it started to kind of go out to where now it doesn't really have any of that. So I got a little bit of tenderness down there, a little bit of like foot pain, a little bit of nerve shooting, and then that kind of settled down 2 to 3 days in. Okay. And then from now it's just kind of the normal, it still flares up, but like it goes back down too. So okay. It's just up and down the normal and good. Okay, so perfect. We got a couple pops and
get some nice releases today.
But it's just kind of settled down now.
Okay, perfect. Well, we're going to go through some spinal adjustments. We usually do some rib adjusting, some extremity adjusting, maybe a shoulder, maybe a hip. And then we do some soft tissue work, myofascial release, and some different muscle techniques. So let's get started. Scoliosis, the ribs can look a little wonky, a little flared in some areas, and you can find adhesions, fascial adhesions, where they should insert near the spine. I also like to follow the ribs out along the ribs and make sure that there aren't any adhesions or things holding up movement in those areas too. Lift of our occiput at our skull bone. Perfect. Okay, let's work on some soft tissue. All right, so we're going to be working on some myofascial release. Because Jantzen has had a scoliosis for most of his life that he knows about, a lot of, not only is the spine off center, but we have these fascial adhesions that are holding his spine and his rib cage and shoulder blade in these incorrect areas. So we need to break those up so that we can allow motion back into the spine. So first I'm just warming the tissue up with this tool. It's called an AccuRoller. You can see on the spine, on the skin, that it makes the tissue a little bit red. We are inducing some more blood flow to come to the area. what would you say this sensation is as we use this tool, Jantzen?
It's almost like a wire brush, but on a roller.
Okay.
Like it's not like stabbing or anything like that, but it's just got like that
Texture to it.
like a blunt tip needle. Like it's not like it's stabbing in your skin, but it's got like a flat, just little like feels like metal. I don't know if it is, but
It is. So we do this to bring some more blood flow to the area. I've had a patient tell me that they feel like I'm tenderizing them like a piece of meat with this tool. And I guess that would be kind of a similar comparison, and it's great for breaking up all of the scar tissue and fascial adhesions. And now that the tissue is warmed up, it's going to be a lot easier for me to use my hands here to break apart those adhesions. The scapula, open up some of this. Give me access to some of the muscles more underneath the shoulder blade. You can see that we have some scar tissue built up here. We should be able to see the border of the scapula here a lot easier. We've got some work to do. Thank you so much for coming this long way to get adjusted and worked on. I really appreciate it.
yeah, it's worth it.
Perfect. So we've had a couple of questions about this table and what do the dropping pieces specifically do. So we have a pelvic drop piece and a thoracic drop piece here. We've got bars on each side of the floor, and when I kick those, both of the tables pop up here. When people are laying on them, we get this extra ½ inch to an inch depending on which drop you're using, and with that extra space we get to use the force of gravity to help us deliver an adjustment. So not only does it feel lighter to the patient, but I also have to use less force to get the job done.